as a girl, and he is a man now. And I have him in treatment for a year already, and I don't think so that his problem is his transformation, but I think that he has autism. So can you see him? Can you look at the diagnosis and assessment? And I did, and he was very autistic. I mean, there was no doubt that he was not. And his problem was totally not that he had a transformation, because he said, I was born in the wrong body, and the only thing I needed is that they correct it. So that was not his problem. His problem was that he could not adapt himself to the daily life situation because of his autism. So I had him in treatment for a period, and after he accepted his autism, he changed and he could cope with his life. And he looked really like a man and not like a woman. And there are a lot of publications. One of the famous publications is Brains Are Not Blue or Pink. And in the Netherlands, we just have a very good publication. It's called We Are Our Brain. And there you see the different meanings, if you can see if they have biological problems, yes or not. So it's a lot of publications are coming on this discussion. What do we know? If we look at the adults, then the estimate of hits in adults range from 1 to 10,000 to 1 to 20,000 in men, and 1 to 30 and 1 to 50,000 in women. And if we look at the prevalence of autism, that is 1%, we think, around that. What is known, what we can find, what we did find in the publications, is an overrepresentation of individuals with autism spectrum disorders. And of course, that more and more publications are coming in which is published that it is not strange that it occurs in the same person. So the comorbidity of autism and gender identity dysphoria is not so strange. There are, if you look at the explanations, there are various options. Gross gender behavior can be attributed to special obsessions with people. I will come back to that later. Gross gender behavior can be considered as an OCD, separately from autism and gender dysphoria that we see in different publications too. I just want to give you some information about our study. In the Free University study, we had 204 participants, and we have children and adolescents. And if you see, we have 108 children, and the mean age was 8 years and 6 months, of which 11 with an assumption of ESD. So we were not sure if they had the diagnosis, yes or not. So that was actually the reason that they invited us. And for all these kids, we used the disco, of course. And but also we did more than, but that's our relationship is also based on the disco. So that was we used for these kids. And if we look at the adolescents, then we have mean age of 13, almost 13 years, and of which 15 with an assumption of ESD. 7 of the 11 children with the assumption of ESD received the classification of autism, 6 boys and 1 girl, of which 1 with the classification of gender identity dysphoria, and the others with not otherwise specified. So they were still in the same spectrum. And 9 of the 15 adolescents with the assumption of autism of ASD received the classification of ASD, 6 boys and 3 girls, of which 5 with GID and classification 3 with GID-NOS, not always specified. Here you see it in tables, but I used the Dutch names, but that's not difficult, I think. The blue one are children, kinderen is, and the green one are adolescents, and the red one are the combinations. So you see the percentage of the group who are in the have both situation. That's actually a lot. And here you see it again, and then we did it in the different groups, in the different cohorts. So what you see is that we have a lot of children with both. I want to give some examples. 6 participants with autism spectrum disorders without gender identity dysphoria. And I give some examples. Some of them are very obsessive interest in soft materials and dolls with long hair. So that were one of the, we saw a lot of these boys actually that they came with it. Then one of the boys said, girls have friends. I not, because I am a boy. So you have to placed me in another body. Fascinated by ladies' clothes, in particular lingerie, that were the adolescents. And teased by boys at school because he was always playing with girls. That was a little boy of 7 years old. So it is difficult to make the differences. Has it something to do, or is it due to the autistic disorder, or is it really a gender identity dysphoria? But anyhow, 7.8% of the 108 participants has an autism spectrum disorder, which is 7 times more than we found in the general population, if we take the 1%. It is a very special combination, and it can occur in one person, and it's not only our research who has shown it, but also other papers. But still, even when some of the kids, after a few years follow them, are not, have not the classification of gender identity dysphoria, still the numbers of referring to the group is high, much higher than we see in a normal group. And some of them, from the examples I gave you already, is very focusing on the behavior things, particularly obsessive, and we saw that was more colored in the behavioral picture by the autistic disorder than with the gender identity disorder. But still, it's difficult